Nipah virus, a zoonotic pathogen initially identified in Malaysia, poses significant health risks to both humans and animals. The virus primarily spreads through contact with infected bats or pigs, as well as through contaminated food and direct human-to-human transmission. To prevent Nipah virus transmission, it's crucial to avoid eating raw date palm sap and to practice good hygiene, especially when handling animals. Public health efforts also focus on raising awareness and conducting surveillance in areas where outbreaks are likely to occur. Furthermore, early diagnosis and supportive care for infected individuals can significantly reduce mortality rates associated with the virus. Research into developing effective vaccines and antiviral treatments continues, highlighting the need for global collaboration in combating this threat. Ultimately, a multifaceted approach involving education, surveillance, and responsive healthcare systems is vital in managing Nipah virus outbreaks. Nipah virus can be transmitted through direct contact with infected animals, particularly bats and pigs, making wildlife a significant factor in its spread. In addition to animal-to-human transmission, the Nipah virus can spread from human to human through respiratory droplets and bodily fluids. Another possible route of transmission is through the consumption of contaminated food products, especially if they have been exposed to infected animals. Furthermore, the virus can persist in the environment, making it possible for people to become infected through contact with contaminated surfaces or materials. Healthcare settings can also be a significant source of transmission if proper infection control measures are not adhered to when treating infected patients. Finally, caregivers and family members of infected individuals are at increased risk, highlighting the importance of awareness and preventive measures in close contact situations. The Nipah virus can manifest through a range of symptoms, often beginning with mild signs that escalate rapidly. Initially infected individuals may experience fever, headache, and muscle pain, which can be mistaken for a common cold or flu. As the infection progresses, severe respiratory symptoms such as cough and difficulty breathing may develop, indicating a more serious condition. In some cases, neurological symptoms like confusion, seizures, and even coma can occur as the virus affects the central nervous system. Additionally, gastrointestinal symptoms such as vomiting and abdominal pain may manifest, complicating the clinical picture. It's crucial for healthcare providers to recognize these symptoms early, as the Nipah virus can lead to severe complications and a high mortality rate. The identification of the Nipah virus in humans begins with recognizing its symptoms, which often resemble those of other viral infections. Following symptom recognition, laboratory tests, such as serology and polymerase chain reaction (PCR) assays are essential for a definitive diagnosis. In serological testing, blood samples are analyzed to detect antibodies specific to the Nipah virus. PCR assays involve amplifying viral genetic material from samples taken from patients to confirm the presence of the Nipah virus. Additionally, other diagnostic techniques such as virus isolation and immunohistochemistry can provide complementary results in confirming infection. Early identification and diagnosis are crucial for effective patient management and to prevent outbreaks of the Nipah virus. The Nipah virus, a zoonotic pathogen, poses significant complications for both individuals and public health systems around the world. As the infection progresses, symptoms can rapidly escalate from mild fever to severe neurological complications, including encephalitis. The primary mode of transmission involves direct contact with infected bats or pigs, as well as human-to-human spread through respiratory droplets. Effective management of Nipah viral infection requires a combination of intensive supportive care and strict isolation protocols to prevent outbreaks. Currently, there is no specific antiviral treatment for Nipah virus. However, research is ongoing to develop potential therapeutic options and vaccines. Public health interventions, including contact tracing and community education, are crucial in controlling the spread of Nipah virus outbreaks. The psychological impact on communities affected by Nipah virus outbreaks can be profound, leading to fear and stigma surrounding those who are infected. To prevent Nipah virus transmission, it is vital to implement strict biosecurity measures in areas susceptible to bat populations. Regularly washing hands with soap and water can significantly reduce the risk of infection after potential exposure to contaminated surfaces or animals. Avoiding the consumption of raw date palm sap and ensuring that fruits are properly washed before eating are essential steps for safety. Educating communities about the risks associated with Nipah virus and the importance of reporting sick animals can enhance early detection and response efforts. Monitoring and controlling pig farms, particularly in endemic areas, helps to prevent potential outbreaks linked to swine. Implementing proper quarantine measures for infected individuals or animals is crucial to stop the spread of the virus. Promoting community awareness campaigns about the signs and symptoms of Nipah virus can empower individuals to seek medical attention promptly. Collaborating with local health authorities to establish rapid response teams can facilitate swift action during potential outbreaks.